Hi, this is Efren Colasso for the assignment practice of scenario. In this case, we're going to demonstrate a video of practicing immobilization or spinal motion restriction for a cervical spine injury. Our scenario is based on a case of a cheerleader that is practicing and suddenly have a fall from a height, landing with the head on the floor on the mat, and then we are gonna go to cover provide services to that injury. Based on our scenarios, we're not gonna be a lot of athletic trainers on the side. Basically, we're gonna be we're gonna have help from athletic training students or maybe coaches. So, giving us that real scenario for us, we decided, or I believe that the best instrument that we can use is the scope treasure, because we can use it with 2 or 3 people. The head athletic trainer with the assistance of athletic training students, or in this case, if we don't have students, we can have the coaches help him in that. So we have the possibility to use long spine boards, but this is not very realistic to our scenario. So I believe that the scoop stretcher is the best instrument that we can use to properly manage the situation. So based on that, we're gonna need the scoop stretcher, some straps, then we're gonna use the cervical collar, and we need something to write notes for reporting what we have done to the EMS. Based on our scenario 2, we are not going to have the EMS on site. So the majority of the scenarios that we're going to have these injuries, we're going to have to activate our emergency action plan, calling the EMS to arrive to the site. So this real scenario is going to be using the help of this athletic training students or coaches. So let's go. We're going to move to the scene once the mechanism of injury is recognized. The first athletic trainer will do restriction of the head or the cervical spine, while the other athletic trainer we're gonna assess level of consciousness, vital status, assess pulse, check CMS on palpate spine. If findings are found on the evaluation, the activation of the emergency action plan would be conducted. Once the emergency action plan has been activated, a third athletic trainer would be helping or collaborating with the other 2 athletic trainers that started the spinal motion restriction or the protocol. This is a real scenario for us that we are gonna be working a lot of times with less personnel than the traditional sites. So we believe that 3 athletic trainers or 1 athletic trainer with help of coaches or athletic administrators would be enough to do the spinal motion restriction. So once started the process, one head athletic trainer keep doing the restriction of the cervical spine, while the other 2 attach the scoop stretcher. Once the scoop stretcher is attached, then we're going to use some straps to promote more restriction and then mobilize the patient out of the field if needed. Now we're going to apply a soft foam neck brace. We believe this type of brace is a better fit based on our scoop stretcher. There's some problem using other cervical collars because they're too rigid, and this wasn't so good for applying to the patient based on our scenario on our scoop stretcher. We're going to grab the scoop, and then Hernan, at your count of 3, we're going to move, okay? We're going to lift her at your 3. Go.
3, 2, 1, lift.
Now, the count of 3 of Hernan, we're going to lift her and then slide to the table. At your count, Hernan.
3, 2, 1, lift. Push, push, push.
Keep going, keep going, keep going, keep going, keep going.
That's it.
That's it. Good. Finally, we're going to monitor and record vital signs. What athletic trainer would do the temperature and pulse rate and respiratory rates, while the other one is doing blood pressure measurement. The third lady trainer will be recording all the measurements for further reporting to the EMS. This process will be completed every 5 minutes until arrival of EMS. So I would like to point some things that we have noticed during the protocol, and something that we have to analyze better maybe when we are trying to make a plan for this. First thing is the scoop stretcher. You have to use it because it's the best scenario, the best thing that we can use at our scenario. But that gives us a little bit of hard time trying to attach the straps. It was a little bit difficult, but that's the best that we can do based on that. So probably in the future, if we're gonna buy some materials to do better spinal motion precision, maybe we can buy a newer or a better scoop stretcher. Then we can have the attachments, the correct attachments for the straps, and at the same time with that old school or aluminum scoop stretcher, we don't have the option to put a strap more on the upper side of the upper extremity. So based on our scenario, we have to do the lifting, relying all that cervical immobilization with the cervical cord. So that's one of the things that we have to at least improve for giving a better services. The other thing was the cervical collar. We have the newest cervical collars, but the old school one, it was better for doing our job. So we have to adapt that to our real scenarios, and that's another thing that we have to analyze in the future, seeing how we can use a properly cervical collar, and that we can use it at the same time with our scoop stretcher. So that's one of the things, various things that we have to analyze on the future. And based on that scenario, then we had to do some adjustments on our emergency action plans regarding to the proper management of cervical spine injuries. Thanks.